Thank you all for being here today. I thought it was really important for MVHS as the local healthcare provider to give you an update on everything going on in our organization. First, let me say, at this point, we do not have any confirmed cases in our facilities, in any of our facilities. That can change with a moment's notice, but at this point, we have no confirmed cases. That said, though, we are putting a lot of restrictions and precautions in place. After a very busy weekend, on Monday morning at 9 a.m., we implemented our Incident Command Center. This is an emergency response system that we drill on regularly, hoping that we never have to use it. Unfortunately, in our community at this point, we did need to implement the Incident Command. Up until this point, we have also implemented many restrictions. We have visitor restrictions in all of our facilities. We have no visitors at all allowed in our long-term care facility, RNC, which is located on the St. Luke's campus. No visitors have been allowed in that facility since last week. We also require every employee to be screened every morning as they come into the long-term care facility, because those are the patients most at risk. We have restricted entrances into our building, and because we have also restricted visitors, we have security guards at each of our entrances, making sure that we're limiting the number of visitors and the potential for contamination. We've closed our cafeteria to visitors. We've eliminated salad bars and soup bars. And we've also even thrown out the salt and pepper shakers. We have developed pathways for our patients to come through the ER or through any lobby to ensure that if they are sniffling or at risk, that they are kept separate from other patients and our employees. We've been training and educating our staff in all areas on the proper use of PPE. Our priority have been those areas that are most in contact with the patients. We've also asked our volunteers to stay home, even though they're very dedicated and want to come to work. Many of them are older and could be at risk themselves. We've eliminated all unnecessary non-emergent meetings, and we are not holding any meetings that include more than 10 people. In those cases, we are calling in and having conference calls. We've also eliminated our board meeting together, and we are holding our board meetings telephonically. We also have travel limits for our employees, and for those that have traveled, there are checks when they return to ensure that we are not bringing any exposure into our facility. So areas that we're focused on and concerned about: supplies and people. We're just like every other hospital across the country. We are monitoring our employees and our supplies. We have physicians doing development plans in their specialty areas. We have a labor pool that we are pulling together, being managed by our HR department. When the school closed on Fridays, we had additional concerns about employees being out because of the lack of daycare. So we are getting volunteers for daycare. We're working with the county for daycare and are managing those requests from our employees through the HR department. We also are concerned about dwindling blood supplies. We are fine right now, but with people staying home and not donating blood, it can quickly become an issue for the American hospitals. So we are working with the Red Cross to hopefully do a blood drive soon. We have not yet canceled elective surgeries. We'll probably talk a little bit more about that. We expect that that will be a dictate coming from the state any day now, but we are still doing surgeries. We yesterday established a drive-through test screening location on Burstone Avenue. It's been open from 11 to 3. We did a soft opening yesterday to work out the bugs of our process. Patients must be referred by a physician. They cannot self-select or just show up. So as we've been saying for the last 2 weeks, if people are concerned, they have symptoms, they need to call their physician and get a referral to that testing site. And that is a process that's necessary so that we can preserve the supplies that we have and use them for the people who are most at risk. Let's see if I have any other important points. Again, we've been telling people, I don't want to disrupt this, to call their doctors, not go to the doctor's office, not to go to walk-in centers, but to first call them. Do not go to the ER unless they are so sick they need to be in the ER. And that, again, is to decrease the opportunity for exposure. We are obsessed as an organization and as healthcare leaders with cleanliness, washing our hands, keeping our areas clean, and exercising social distancing. And for an organization that's pretty social, this is hard, but it is really important that we all keep our distance from each other. We also are concerned about the long hours and the stress that healthcare workers are placed under in times like these. So we are asking our staff to tap out when they're tired and they need a rest. And if they don't do that, then their supervisors will require it. So we are urging all of our community to stay home if you're sick, to wash your hands frequently, cover your cough if you sneeze, and clean all the high-touch areas in your offices or in your homes, and to monitor your systems. Most of all, it's important that we all stay calm, and we believe that if, as a community, as a state, that we all do what's the right thing to curtail the spread of this virus, we'll be able to get back to our coveted lives as soon as possible. Now with that, I would like to introduce Dr. Kent Hall. Dr. Hall is the Chief Physician Executive for the Mohawk Valley Health System.
Good afternoon. Thank you, Darlene. So I just want to emphasize a few things that Darlene talked about. Number one is that really from a personal standpoint, the best things that people can do is to take care of themselves, and that is just what Darlene said, washing hands, covering your cough or sneeze, and continue to do social distancing. That's what's going to really help to stop the spread of this, okay? The reality is, again, as Darlene said, we have 0 cases within any of our facilities. We do know that there's 1 documented case within Oneida County, and the Oneida County Health Department is monitoring that person, as is their duty. And they are keeping us apprised of where that person is and what we may need to do should they get sick. That being said, we are also looking at patients within our facilities who are ill and who have influenza-like symptoms and are testing them appropriately. So far, none of those tests have come back positive. We are doing appropriate isolation for those patients to make sure that should they come back positive, that we have not been exposing people that would otherwise need to be quarantined. We are following the guidelines both from the World Health Organization, the Centers for Disease Control, and the Department of Health in terms of what is required for caring for patients, for preparing, and for making sure that people are as safe as possible. And that includes such things as what do we do when we have a healthcare provider who is themselves potentially exposed, and should they continue to work or not, and under what circumstances should they? So those are all fairly well delineated through the Department of Health and the CDC, and we really appreciate what their guidance says. It is important for everybody that everybody know that we are following what is best knowledge and best practice at this time, and that if everybody does that from a community standpoint and from a health standpoint, from a health care standpoint, that we will get through this. This is, as I've said, this is a marathon, it's not a sprint, and we will be able to get through to the other side, and we will be able to, as Darlene said, to get our lives back. So with that, questions either for Darlene or for me, I'll be glad to take whatever, and I think Darlene will too.
Absolutely.
I know you mentioned that people need to be referred before going to these test sites.
Yep.
Were there issues yesterday or even today with people showing up and
Please step up to the podium.
I don't believe that anybody has showed up. We do have people that are showing up in the ER that we would prefer not to. If they're really sick, they should show up in the ER, but we haven't had any walk-ins, I don't believe, as of noon today from the last 2 days in that site.
so that's a good thing?
That's a good thing. So we do see that has been a real consistent messaging out to that, and I know you guys have been part of that. We appreciate it. It really helps. It really helps for people to call their doctor and not just show up.
How many tests did you administer today?
We did 3 yesterday, and I believe so far today we've done 9, but don't hold me to the specific number.
How many?
5 an hour.
Yeah, and then our plan is to do 5 an hour.
Right.
Are your staff already getting worn out from responding to?
Probably the leadership staff more than the clinical staff. Of course, everybody is working with a heightened sense of stress. For those on the front line, the folks that work in the ER or in the ICU, where we have tested some patients, there is certainly an increased level of stress and awareness of the potential of a positive patient.
And I would add to that the reality is that that the people who are caring for our community are also parts of our community, and they're, looking at Facebook and, seeing what's online, and there's a lot out there that is inaccurate and that's relatively inflammatory, and that is really not very helpful, and then they come to work and they're saying, well, why aren't we doing this? This is what I read on Facebook and things. So it's a chronic, recurrent conversation that we need to have with the staff, just as we do with the community, about what is the best thing to do to really protect themselves.
What are some of those inaccuracies that you're hearing?
Well, so an example would be somebody coming in and saying, I heard that we should be in full protective gear from the time that we walk in the door until the time that we leave, and that we shouldn't go home to our families. Those are some of the things that I personally have heard that are just creating huge amounts of fear, honestly.
So you mentioned that you're not at this point discontinuing elective surgeries.
Right.
I believe St. Luke's has a dental clinic. Is there any discontinuance of
Yeah.
elective
So-
dental?
So yes, so good point. We have looked at what would be best for those patients, and we have decided that we will limit the use of that clinic to emergency patients, and that the routine care will be delayed until we can assure that we are providing a safe environment for them.
You said that you haven't postponed any elective surgeries yet, but you expect that to happen. Would that just be in hospital elective surgeries, or in ambulatory care, or in doc procedures in doctor's offices?
So I think the state will give us guidance on what that is. I think the state is definitely, and just earlier today there were some discussions about it, that they will define what we need to do. However, and I'll let Ken answer this, defining what is an elective surgery can vary. So you want to
Yeah,
talk about
so let me give you a little bit of background first. So there are 2 reasons to delay elective surgeries in this instance. Number 1 is if you do not have the capacity, or you need that capacity to care for an influx of patients otherwise. Right now, we're not in that environment. The second is if you have patients that are infected, and a number of them that are infected within the facilities, and you do not want to bring people that are otherwise relatively healthy in for elective surgeries to come in to have procedures in that environment. And again, we're not there yet. So that for those two reasons, we're feeling internally that we're not in a need to stop elective surgeries. That being said, we also know that this changes on a moment's notice and that there are directives that come down from New York State that may very well say that everybody is going to follow that, and that's fine. So then it goes to the question of what is considered an elective surgery. Well, an elective surgery to a very great extent is in the eye of the beholder. If you're the person that needs a knee replacement, you may not feel that that's elective. So we really have to be very thoughtful about that. We have a group of providers, both people who would be doing the procedures as well as people who can take a step back and look at a bigger picture to make a decision about what would be considered truly elective procedures. We also believe that when push comes to shove, there may very well be some directive that comes down from New York State, and if so, we will be following that as well.
Is there any discussion about closing non-existing medical, I'm not being coherent, outpatient visits for people who aren't actually sick?
Yeah, so again, we're putting those kinds of decisions in the hands of the physicians. If a physician feels that a patient should not be coming into the office for a visit, or that patient is concerned about coming into an office for a visit, some of those patients are being canceled. That said, there are definitely people who are chronically ill that need to keep their doctor's appointments. They need that ongoing support. So we're putting those kinds of decisions in the hands of the physicians. What's the right thing for the patient? Depending on how this virus grows or spreads across this community, some of those decisions will be revisited. So we're looking and following what the CDC and the state guidelines tell us to do every single day, looking at the updates and update our plans based on what we've learned.
Are any extra precautions being taken with mothers or with pregnant women?
Mm-hmm. Yeah, so yes, we are certainly looking at the most vulnerable populations, whether they be pregnant women or their newborn children, and making sure that we can keep them as safe as possible. Right now, there aren't a lot of directives in that area because at this point in time, it seems that seems to be a relatively protected population from this, in that they don't seem to get it as badly or as either in terms of how sick they get or in terms of just how many people get sick. But we are looking at making sure that when and if this gets into a higher level, that we are protecting them as well.
Yeah, so if I can just answer it, one thing that we have done towards that population is that we certainly are limiting visitors. We do have children in our level 2 nursery, and while the rest of the hospital, we are allowing only one visitor at a time, 14 and older, for only 2 hours during the day. In the newborn nursery or in the special care nursery, we are allowing both parents to come in should the nursing staff feel that that is a safe thing to do.
When you're talking about that group tends to be protected, are you talking both pregnant women and newborns?
It's really more the newborns that tend to be more protective. Pregnant women, I'm not aware of any data that shows that they're at greater or lesser risk.
And what about in the, I don't know I forget what the building's actually called, but the senior center by St.
yeah.
Luke's? Are there precautions being taken?
Yeah, we call that RNC, that's our long-term care facility. There are no visitors allowed, and we've implemented that, I think, last Wednesday. None, 0, zip. And we called every family member to tell them. Most of them are really appreciative that we've done this. We've eliminated every meeting on any outside vendor, et cetera, coming into that building because it's such a high-risk population. And we're requiring that every staff member be screened every morning or every shift change when they come into work.
What does that mean when they're screened?
We take their temperatures, we ask them about if they've got coughs, sneezes, et cetera. And we do that every shift change to make sure that we are not introducing anything into the environment.
The county executive yesterday mentioned that the county is having trouble getting enough PPE in for all of its first responders and stuff. What's happening within the health system?
Yeah, so those are the two areas that we are strained the most and believe that we will be increasingly strained is with those resources, is the PPE and basically supplies, and with people. And by people, I mean, I'm talking about all of the healthcare workers, whether they're doctors or nurses or clinical assistants or whomever, that are caring for patients and may get sick themselves. But that is an area that we are checking our inventory on a regular basis and asking for help across the state. I will say that so is everybody else, and the state also has a very limited supply, and so they are doling it out as best they can. That is something that we're going to need to understand, and we have actually gone to the Department of Health and says when we get to the point where we need to potentially reuse things that were supposed to be reused, that were supposed to be single use, how do we do that? And they're not ready to give us that directive yet, but they are looking at it.
How's the state hand sanitizer supply holding out?
As far as I know, it's okay, but that's honestly not one that I've asked.
Yeah, when it comes to the supplies, we have done an inventory. As you know, we have a lot of different buildings and a lot of different parts to our organization. So we're looking at inventory in all of our places and figuring out where we can and should share, should that need arise. But we know that if we continue to use supplies at this level and what we're seeing in other places, it will face a shortage. So we have given our list of needs to the county and asked them to please be an advocate for us and our county.
You mentioned a blood works being planned, do you have dates or?
I don't believe we do. If we do, I don't know what they are.
Yeah, I know that we're in the process of trying to set them up, but I'm not sure that they've actually been planned yet per se.
I know Dr. Hall and I had talked about this a little yesterday, but I wanted to try to dig you down more as far as the directives to expand bed capacity, both for critical care and for general admission. How are you seeing yourself able to do that?
So we actually just came from a meeting where we're looking at how we will build the ICU care, critical care into the organization and where we'll start and where we'll grow and where we'll grow. We also are doing labor because it's really about the labor to take care of those patients, not necessarily just the space. We've got a lot of buildings, you know, in this community, so space is not an issue for us. It's the labor to take care of the patients. We believe if there is a surge in the need for people for special care, we will have other parts of our organization where we don't need that staff and we will shift them. Right now, we are collecting names of people who can do more than one job, who might be able to help out in other areas. We have volunteers, retired people that we're soliciting to see if they would come back and come to work. And the state is being, I think, lax and creative in how to license people and get them back to work as the need may be. Facilities-wise, we feel pretty good about the space. It is the employees that are probably the biggest concern. Go ahead.
We're going to right.
Anyone have other questions? Anything we forgot to address, Dr. Hall?
I think that just about does it.
If someone is very sick
Yes.
and wants to come to the ER, do they call 911 every time? Do they let a family member drive them?
Yeah, it would be really great if they called ahead and told the ER they were coming in, especially if they have any of the symptoms for COVID-19, to let us know, and then we can handle them appropriately right as they arrive. That would be very helpful to us.
What I would say, though, is that honestly, if somebody is sick, I hear about people having chest pain and driving themselves to the emergency department, which gives me chest pain. If you're sick and it would be dangerous for you to drive, if you're having symptoms of a heart attack or a stroke or something like that, then yes, you should absolutely call 911. That's what it's there for. If you and/or your loved one feel that it is safe for you to drive, then absolutely drive. And if you're coming in because you're concerned about possible infection and you're sick enough that you feel you need to be seen in the emergency department as opposed to calling your primary care doc, then yes, calling ahead would be the great first thing to do. That being said, I will say what I said yesterday, which is that the first thing, if you're otherwise not overly sick, calling your primary care doctor is the best thing to do, especially if you're concerned about having this kind of a virus.
And just one thought I would also like to just leave everybody with is while we are definitely focused on this as an organization, as a state, as a society right now, we're still an active community hospitals, and are seeing patients on a regular basis. We have traumas that are coming in. We are having heart attacks that come in. We are doing surgery, and we're doing some complicated surgery. So while we're planning this, we are still an active community hospital system taking care of our patients.